by keeping in view this entire, kind of circle which is meant, which a woman has created, or it's there in terms of family and office and kids and relatives. So what are the key things that a woman needs to do in order to prioritize her health? Specifically, if we talk about the diet, the food that she is taking, is it going to affect? If yes, like, what's the percentage of that? So how she's supposed to prioritize her heart health?
So, first of all, I would like to emphasize that we have to start taking care of our heart health right from the childhood. We don't have to wait till we become adults and we become elderly. So, because the blockages in the artery, it is dependent on few risk factors. Some of them they are not modifiable, like the hereditary risk factors. So, if our parents are affected, then genetically we are at more risk. Then some races are at more risk, like I told you that Indians they are at more risk compared to the Western population. And also, it is seen that as we grow older, the risk of getting heart disease they are increasing. And also the gender difference, like some diseases they are more common in females, so we have to be aware about that and we have to take care of that. So what we can do is that because we cannot modify the unmodifiable risk factors, so we should take care of the modifiable risk factors. So we'll talk about the modifiable risk factors, and one by one I'll tell you about it, like you told about the diet. So we must be aware that the guidelines say that we must take at least 5 to 6 servings of fruits and green vegetables every day. So most of the people they are not taking fruits and green vegetables. So what they are taking more is fried food. So the fat intake is more. So we must know that the fat is bad. It is going to deposit in the wall of the blood vessels. So the recommendation is that your daily intake of oils should not be more than 10 ml. Like 1 teaspoon is 5 ml.
Oh,
So
okay.
in a day, it should not exceed, for all the cooking and whatever you do, should not exceed 10 ml in a day for one person. So you
Right.
can easily calculate your oil consumption by the amount of oil you purchase every month. So
Oh.
if you are purchasing, say if you are having 3 people in your family,
Hmm.
so 30 ml per day means 900 ml per month. So if
Yes.
your oil consumption is more than that, if your oil consumption is say 1 liter or more than 1 liter, like 2 liters, that
Hmm.
means you are consuming more than 2 times the recommended oil you should be consuming.
Oh
Plus,
God.
we should not take saturated fats like ghee
Uh,
and butter. So they are bad for the health. And the trans fats are very bad. The trans fat is like in when you see that in the market, like they put oil and all day they are heating the oil and keep on frying various things. Like in India, they fry the pakoras and samosas. So these are having very high quantity of trans fat. So this is very harmful. It can even cause heart attacks. It can cause cancers in the body. So that is totally avoidable. Apart from that, like we should restrict our salt intake to less than 1 spoon in a day for the entire cooking and entire whatever, like extra things we snacks we take. So 5 gram is the limit for normal person, and if you are having high blood pressure, then it should be maybe less than 3 gram. And sugar also, you should not take more than 1 teaspoon in a day, entire day. So
oh.
5 gram is the limit for sugar also. So if we take care of all these things,
Hmm.
then the chances of getting heart attacks will be less. And in women especially, we have to take care that like some women they have hypothyroidism in this sub Himalayan region. So
True.
and they have a tendency of gaining weight. So we should be aware whether we have hypothyroidism or not. And
Hmm.
also, like women after pregnancy, like there is a increase in the weight, say 20% increase in weight occurs during pregnancy. But
Okay.
after pregnancy, and if you are lactating your child, then this weight should come back to normal. And those women who have high weight after say 1 year, so they are the women who are more likely to get heart disease, high blood pressure, diabetes later on in their life, and obesity. So we should make sure that after pregnancy, your weight should come back to normal within 1 year. And also, like obesity is nowadays becoming a one of the important risk factor. Like first of all, smoking is the number one preventable cause of death nowadays, and number two is obesity. So we people in this region have a different kind of obesity, what is known as apple shaped obesity. So here the overall body may be okay, but we have more fat deposited in the abdomen. So this
Yes.
is known as apple shape. So in the Western population, they have the pear shaped, where there's more fat in the thighs, in the buttocks, in the shoulders. So their risk of getting heart diseases is less compared to the people who have apple shaped obesity. So the cutoff limit for the Indian subcontinent, it is, and even the Asians, it is much less. So if we talk about the BMI, body mass index, which is your weight per square meter of your height. So for Western population, the cutoff is 30. So above 30 is obesity. So 25 to 30 is overweight, and below 25 is normal till 18. But for Indian population and Asian population, and I think this includes Pakistan also, the cutoff limit is much lower. So from 18 to 22, it is normal. From 22 to 24.9, it is overweight, and above 25 is obesity. So everybody should know your few figures, like what is your resting pulse rate, your blood pressure, and your uh, like waist circumference, which is very important. So waist circumference is not the size of waist in a jeans or in a trouser you wear, but it is the waist circumference at the level of the umbilicus, like the navel. So
Right.
your waist circumference should be half of your height. So
Oh.
everyone should calculate your waist circumference, and if it is more than half of your height,
Hmm.
then you are apple shaped obesity, and then you have to reduce your waist. So
Oh.
this is one of the most accurate indicator of risk factor for heart disease in future.
Okay, okay, that's really an eye-opener conversation because most of the things that you have told us about the food intake, I am sure majority of the people are doing opposite to it. Even
Opposite
you have
opposite.
mentioned,
And
unfortunately, it's like, we really need to, I guess then we all are at the risk of, this disease, God forbid.
that's why we are affected at least around 15 years earlier than the western part. So in this region, like we get affected much more earlier than the western population.
And that's primarily because of the food intake, what I can like process right now from your conversation, because we like people from India and Pakistan and other like related nations, we are like more into these fried food
Right.
and these
Yes.
samosas and pakoras and things like that. So we really need to look after this. And I'm sure the people who are going to listen to this, they, especially the women and the people who are in charge of the kitchen, they really need to look after what exactly we are getting inside us, because then it's coming outside in form of heart attack and God forbid these
Yes.
diseases.
And
So,
another important thing is that uh, the breakfast should be the best meal. But most of the
yeah,
people, like especially women, they skip their breakfast or they take it
true,
too late.
true.
And the lunch should be less than the breakfast, and the dinner should be the lightest.
And it's
So,
opposite.
uh, so if we want to have a V-shaped figure,
Hmm.
So the shoulders should be broader and your waist should be narrowest.
Yes,
So
yes.
if you take breakfast as the heaviest, you will have broad shoulders, and
Oh.
if you take dinner as the lightest, you will have narrow waist. So narrow
Mm.
waist is considered very healthy. So you must have heard a lot of songs which are based on the waist.
Yeah, yeah,
So
exactly, exactly. So
they
there's this
appreciate.
medical relation with this bit. That's what you're
Listen,
saying.
this actually
Oh,
the narrow waist is considered to be uh, significant of a more healthy individual.
okay, that's something really important, and I'm sure that every woman would like to have it because of the health
Yes.
and overall fitness as well. That's great.